welcome to Spear Medical Education. I'm Eric, and this is another one of our explaining series where today we're going to look at what shock is and run through the different types of shock that we're concerned with. So what is shock, to get started? It's not what we commonly see on television and movies where somebody sees something horrific like this car crash, and because they've witnessed it, they're not actually involved in it, but because they've witnessed it, people say, oh my god, he's going into shock. Or similarly, I've been on the receiving end of 999 calls where, again, somebody says, they've been in a little bit of a shunt. There's not much damage to the car, there's no injuries to the patient, but they're really in shock. What they mean is they are shocked by what's gone on. It's caused some sort of confusion, some sort of disconnection from the incident psychologically, and they're shocked by what they've seen. What we're talking about is physiological shock here, so not they've seen something big and scary, but actually there's been something that's happened to the body and it's physically causing them to go into shock. So that's what we're going to look at today. So here we go. So as you can see on there, it says a drop in circulatory pressures resulting in a lack of tissue perfusion, and it's as straightforward as that. But by circulatory pressures, we're talking about the pressure with which blood is being ejected from the heart around the body through the blood vessels. So the pressure at which that occurs has dropped for some reason, and we'll look into what those reasons are in a moment. But the end result is the same, regardless of what's caused that drop in circulatory pressures. Blood that has oxygen and nutrients isn't getting to those tissues, those organs in your body furthest away from the heart, and it's resulting in those, first of all, dysfunction in whatever that is. So if that was your kidneys, it's not receiving oxygenated blood because you're in shock, then your kidneys will start to malfunction and eventually fail, leading to death. If your brain isn't receiving that oxygenated blood, then again, your brain's going to start to shut down. You're going to start becoming confused and agitated, and eventually unconscious, and then death. So we need oxygen to be getting everywhere it should be getting in the body. And like I said, if we lose that pressure, it stops happening, and that's what shock is. So I've got some examples of what could cause shock here. So hopefully, in fact, we'll just zoom in on these three, and we'll go down to the other two in a second. So hopefully you can see these. So what we've got here is, let's choose a good colour. So at the top here, we've got the heart and the blood vessels as it normally is. So this is your heart, this is your blood vessels. The shape of it is representing how, the diameter of the blood vessel, and then the red in it is the blood, and it's getting to an organ, let's just say your brain. So under normal circumstances, your heart's beating normally, your blood vessels are full, so there's no room for anything else, and it's moving under high pressure around your body and getting exactly where it needs to go. So this is what we'd consider to be, I'll not use that pen, normal. Below it, we've got a happy heart, so the heart's fine. However, there's a damage in the blood vessel here, and it's causing the blood that was in this blood vessel, so in this potential space, to leak out onto wherever the floor, or if it's internally, inside your body, wherever there's blood that has left your blood vessels and it's no longer there. So that drop in fluid is going to result in a drop in pressure. So all of a sudden, you can see here the blood's getting ejected from the heart at the highest pressure it can manage with its sort of leaky problem, and as it gets closer and closer to the end organs, we're barely getting anything there, so only getting like this much oxygenated blood reaching the brain, kidneys, whatever sort of organ you want to talk about. So we call this one hypovolemic shock. Hypo meaning low, volemic, volume of blood, essentially. Hypovolemic shock. So it's shock caused by blood loss. Below this, we've then got happy heart. So the heart's functioning normally, but the brain is still not receiving adequate oxygenated blood. So we're not leaking anywhere. There's no holes in the blood vessels or anything like that. The heart's working as it should, yet we've got a drop in pressures. Now, what's caused this? Now, if you notice, the blood vessel's dilated. It's bigger. So there's still the same amount of blood in the body. You've still got your average sort of 5 litres of blood in the body. It's not gone anywhere. But the vessels that were carrying the blood have dilated, and because they've dilated, that's so drastically, because they've got wider, that's caused a sudden and drastic drop in the pressure of blood. So the blood pressure's dropped off, and same again, we're getting a reduction in oxygenated blood reaching the end organ. So this, you normally see this in sort of like people that are sort of too hot. So when people get out of the bath really quickly, if they've been in a really hot bath and they stand up suddenly, as your body sort of adjusts and all your blood vessels start to tighten up again, before that happens, you can have a faint or a near faint episode. Or one of the more common reasons is anaphylaxis. So when you have a severe allergic reaction, I've spelled that wrong, it's fine. Anaphylaxis. So it's anaphylactic shock. I've spelled it correctly on the next slide. So anaphylactic shock. So that's where your blood vessels dilate, they become wider, and actually it's not the full story. Anaphylaxis is a lot more complicated than that, because also what happens is some of the fluid that carries blood around the body, so not blood itself, but the sort of transport medium that takes it around the body, also starts to leak out of the blood vessels. Because they become more permeable, so like little holes appear, if you like, on a cellular level in the blood vessels. So that also results in a drop in pressure. So you've got sort of two things happening. You've got these really dilated blood vessels, but they're also very permeable, and this causes anaphylactic shock. But either way, no matter what's caused it, anaphylaxis is one example, but there's other things that can cause it. Like I said, sudden changes in heat. You end up with a bigger blood vessel, thus lower pressures. Okay, so we'll look at these two next. So we've got, let's just zoom this in a little bit tidier. There we go. So another two that we've got here, we've got an unhappy heart, an unhappy brain. The blood vessels are the same, so it's a normal size blood vessel. It's not dilated like on the last example, and it's not leaking anywhere. However, what's happening here, instead of it being a problem with your pipes, your blood vessels, it's actually a problem with the pump, which is your heart. So for whatever reason, your heart isn't beating efficiently. So it's either not contracting sort of really, really hard and allowing blood to be fired off at really high pressures, or it's beating too fast that it's not allowing the chambers of the heart to fill fully, or it's just beating out in sort of like a really uncoordinated way, which again isn't allowing the chambers to fill correctly, which means you're not getting the sort of most efficient ejection of blood from that left ventricle. And whatever reason, there's something wrong with the heart isn't playing properly, and it's resulting in a really inefficient flow of blood from the heart. Because of that, again, we get this drop off in pressures in the blood vessels, which results in shock, in lack of oxygenated blood reaching the end organ. So we call this one, oh, that's not writing, cardiogenic shock. Finally, we've got a sad heart. The heart's not working correctly. We've got, excuse me, we've got this sort of lack of volume or lack of pressure of volume in the pipes in your blood vessels. And then over this side here, you can also see that the brain's not working correctly. However, I've put this arrow on here to highlight that actually the heart's fine, but the control center for the heart, the brain, isn't controlling the cardiovascular system as it should. So if the heart's the pump, the brain is the thermostat in this sort of analogy. The brain isn't controlling the heart properly, or isn't controlling the sort of resistance in your blood vessels properly. So this could occur after sort of a severe blow to the head, so severe sort of head trauma, or it can be through certain diseases of the brain. Either way, the cardiovascular center of the brain isn't working correctly, thus the heart isn't working correctly, thus we're not getting sort of a good supply of oxygenated tissue, oxygenated blood, sorry, going through your blood vessels to the end organs. So we call this neurogenic shock because it's brain, it's from, in origin it's from your brain. So neuro being brain, and then genic shock. So the heart's not damaged, the heart's not being inefficient of its own accord. There's no loss of blood volume or anything like that. The blood vessel is the same size, so it's not dilated. However, the control center of the brain, for whatever reason, isn't sort of controlling the cardiovascular system as effectively as it should, which then results in the heart not doing what it should and the blood vessels not sort of working as efficiently as they should. So that's neurogenic shock. Right, okay, we're nearly there. So as you can see here, I've just given you some causes of shock, just explaining sort of what we've just looked at before in another way. So remembering that shock is a lack of oxygenated lack of oxygenated blood perfusing your organs for whatever reason. It doesn't matter so much what the reason is at this stage. It does when you were talking about how to treat it, and certainly in hospitals. They'll want to know what's causing the shock and sort of how to treat that to try and reverse it. But for us at this level, we just want to know what shock is. It doesn't matter that, that's hypovolemic shock or that's cardiogenic shock. The thing that's important is what shock is, which is that lack of oxygenated blood perfusing your organs for whatever reason. So like I said before, we've got that cardiogenic shock, which is your problem with the heart, hypovolemic shock or hypovolemia, and then that's that your blood's going somewhere it shouldn't be, so it's out of the blood vessels, either on the floor or into your body internally. Got anaphylactic shock, which put this poor little bee there. Bees get a hard time with this. Obviously, there's lots of other things that cause anaphylaxis, but that's another cause. We've then got toxic shock, which again, it's an introduction of some sort of toxin to the body that is interfering with the normal function of the cardiovascular system, resulting in shock. We've got sepsis. So again, that sort of systemic, that widespread all over your body, life-threatening infection eventually starts to interfere with your cardiovascular system, makes your blood vessels dilate and become sort of wider, dropping your pressures off in your cardiovascular system, resulting in that drop in pressure. Neurogenic shock we've just discussed. It's again some sort of insult to the brain, which would normally be controlling the sort of cardiac output from the heart. And then burns as well. We are talking quite severe burns, but when large portions of your body become burnt, that sort of clear fluid, that sort of transport medium fluid that we introduced earlier, starts to leak out of the blood vessels and again into the surrounding tissue. So whilst that fluid is still in your body, it's not in your blood vessels, and it's in your blood vessels where we need to maintain that pressure. So that change in fluid, sort of the volume, results in a drop in pressure. Cool. Right. Moving on then. So we hear it in sort of your TV medical documentaries all the time. Oh my God, he's going into shock. But what does that actually mean? Well, we know what it means now. We know what shock is, but what does that look like? What sort of signs and symptoms could we see in patients that are going into shock? And even though you've got all these different causes of shock, these different types of shock, generally the way the patient presents will be the same regardless of what kind it is. You're not looking for a different kind of a different set of symptoms for somebody who is suffering sort of hypovolemic shock versus somebody that's suffering cardiogenic shock. The symptoms largely will be the same at this level for us, just trying to identify shock. That they're all going to be the sort of same sort of symptoms. So, and those symptoms are for us, without lots of medical equipment or anything like that, or labs. All we're looking at is up here first of all. So in your B, so your ABC assessments and your breathing assessments, we're looking at rapid and weak breathing. So the respiratory rate's going to be elevated, and they're going to be breathing quite weakly. So just really sort of gentle rapid panting. You're going to have, if you try and find a pulse, so we're trying to find this guy's radial pulse, it'll either be absent. Don't worry, just because it's absent there, it doesn't mean that they're necessarily dead. You can lose this pulse, because if you think about it, as the pressure drops off in the system, remember what we said before, the end organs, the areas furthest away from the heart, are going to be the first places you're going to lose perfusion. So the hands are obviously nice and far away from the heart. You can lose this radial pulse, this pulse in your wrist, but still be alive. So if you was to not be able to find this pulse, but then you went to find the pulse in a person's neck, for example, you might find that they've got a pulse in their neck, but not a pulse in their wrist because they're in shock. They're in quite a sort of high degree of shock. So you're looking for the pulse being absent, or if you can feel it at the wrist, it'll be weak and rapid. So it'll be really, really difficult to feel, and it'll just be beating away really rapidly under your finger. And then if you're sort of trained in sort of checking people's blood pressures, you'll find as well that their blood pressure, their systolic blood pressure, the upper number, will be quite low as well. And then so that was your B assessment, that's your C assessment, and then your D assessment, your disability assessment. You'll find that remembering that the brain at the moment isn't getting oxygenated blood plus other nutrients taken to it. So they're going to be confused, they could be agitated, and they could even be unconscious if they've got to that point where they're just not getting much of anything at all to the brain. So these sorts of symptoms combined is definitely what will be leaning us towards, yes, this person is in shock. So what do we do about it? So, there we go. Right, okay, so treatment-wise, it all depends on your skill level, as always. So I've put sort of the stuff in black that all of us can do, and then depending on your skill level, then obviously just a sort of some of the stuff in red that you might do. So treatment: lay them flat. So we want to lay them flat, really. So the last thing you want to do is stand them up, because if they're stood up, you're creating more resistance via gravity that the heart has to overcome to get blood to the brain. So if you're laid flat, it doesn't have to work particularly hard to get that oxygenated blood to the brain. So it doesn't have to work particularly hard to get oxygenated blood to the brain. It's just got to overcome. It doesn't have to overcome that much gravity. Whereas if they're stood up, it's got to overcome gravity, and obviously it's gonna make its life even harder. Reassurance: we massively underestimate the value of reassurance. So the person's body's already sort of in overdrive. It's already working really, really hard to compensate for this lack of volume in the blood vessels. So by them being stressed, anxious, scared, you're putting more physiological demand on the body unnecessarily. We can't do anything at this stage about the fact that there's a lack of volume in the blood vessels, but what we can do is try and ease some of the other stresses on the body by giving them bags and bags of reassurance, letting them know that they're going to be okay, that we're going to look after them, and that either help's on the way or we're getting them to help. Then we're going to keep them warm. None of these patients will, there's no patient that won't benefit from sort of being kept warm when they're in shock. Again, their body's already working really, really inefficiently. We don't want to exacerbate that further by having them be cold either. So getting a couple of blankets on them, not letting them sort of strip down to their underwear in the middle of the road or anything crazy like that. We just want to keep them warm. Again, we're just trying to do everything we can to reduce that physiological demand on the body that's already there. And then if you are working in a system, so you're remote offshore medic, military medic, paramedics, docs, whatever, then obviously we'd be looking at getting some vascular access, so getting some access into their veins, and then we're looking at some volume resuscitation or replacement depending on how poorly they are. So that's just getting some fluid products or some blood products back into those pipes to restore that volume, which will restore the pressures in the pipes. There's a lot more treatment, because again, if it was anaphylaxis, for example, we'd be giving other treatments as well that would be helping out with tightening those blood vessels back up, and alongside that, the administration of volume. But anyway, so that's what we're looking at sort of from a treatment point of view. So that's it. That's shock in a nutshell. So we'll just end on this slide over here. There we go. Just as a reminder of what they all are. So that's shock. There's lots of different causes. Ultimately, it's the same thing. It's that lack of oxygenated blood perfusing your organs for whatever reason. Thank you very much. If this has been helpful to you, please give us a like and a subscribe down at the bottom of the channel. It really, really does help us out, and look forward to more content from us soon. Thank you.